Um, can you just share some insights into what's on the market, what's available for pelvic floor issues? Because they can be invasive and non-invasive, can't they?
Absolutely, yeah. So for pelvic floor issues, so the biggest two are incontinence and prolapse. Both of these will affect a third of women in their lifetime. So the NICE guidelines and the gold standard treatment for both of these, first and foremost, is pelvic floor physiotherapy. So a supervised and individualized program for between 3 to 4 months of pelvic floor exercises, which would be classed as non-invasive, obviously, except for the vaginal exam initially to check on technique. Lifestyle advice plays a big part as well in pelvic floor dysfunction. So, after asking all the questions and finding out about the individual, the treatment would include lifestyle advice, diet advice, making sure that we're eating, drinking, doing the right things as well. There might be some medication that they can take. So particularly for urgency, overactivity of bladder, we might also be able to look into medication to help. And with prolapse, there's pessaries. So normally silicone, sometimes plastic devices that can be inserted inside the vagina that can help to support prolapse alongside pelvic floor exercises. The last port of call for both of those would be surgery. So that's obviously the most invasive treatment, but that is the very last port of call.
Just a quick add on there, surgery is not always definitive, is it? It can recur.
Absolutely.
I think anybody considering pelvic floor surgery should be very much aware or made aware of the fact that this is not, this may recur in 5 to 10 years. It's highly likely that you may have a recurrence of some level or another. So I think in the olden days, we'd hear lots of women going through, well, I've had 6 prolapse repairs, almost like a badge. Okay, thank you for that.